RQF BTEC, Health and Social Care Level 3. Unit 2, Working in Health and Social Care, Learning Aim A. This PowerPoint will be looking at dealing with conflict in health and social care settings, and we will be looking at the best ways in which you can deal with someone that is quite aggressive or very angry towards yourself. What I'd like you to do first of all is I'd like you to think about the reasons for conflict occurring in a health and social care environment. For example, a hospital. Why might somebody be aggressive towards another person, or angry or verbally abusive towards another person? What I'd like you to do is stop the PowerPoint very briefly and make some notes on what do you think the main reasons for this occurring is. Hopefully you've had a chance to write some ideas on the other page. What you've got to realise is that in a health and social care setting like a hospital, there is life and death situations, there are long waiting lists, there are people that are panicked, there are people that are worried, concerned, there are people that might be in hospital because they're on drugs or some form of substance abuse, and a lot of conflict can occur from this. Conflict can also occur from miscommunication or a lack of communication, and there's some of the main reasons that conflict can occur. Conflict in a health and social care environment is very common. Challenging behaviour means any behaviour that puts a service user or anybody in the setting at risk or significantly affects their quality of life. This can include things such as people being rude, people being aggressive, someone committing self-harm or disruptiveness. Professional carers should be trained to deal with conflict, because regardless if you're a teacher, nurse, doctor, social worker, you will come across many aspects of conflict. Conflict can occur between service users and the doctors, nurses, between care workers and their clients, and between the service users and their family or informal carers. If you're a domiciliary care worker, there should be a lone workers policy in place with specific guidance for dealing with any situation where you feel vulnerable, such as dealing with a conflict and aggressive behaviour. That policy there is to protect you. An example of where lone workers policy would be used in the exam is they may be talking about a domiciliary care worker or a district nurse that is required to go into the homes of an individual. You may be therefore required to talk about the lone workers policy there, which is guidance and procedures aimed at ensuring that people working on their own are kept safe. This is particularly important when providing domiciliary care, so care in the home. Lone workers policies are in place to principally protect the carer from harm, but it will also provide protection from service users. So it will give specific guidelines and instructions to follow when you are working in somebody else's home to keep you safe. So how to deal with conflict. I'd like you to look and research some of this yourself as well, but the main things are to never resort to aggressive behaviour. Just because somebody is shouting at you doesn't mean that you shout at them back. It doesn't mean that you raise your voice, because that can actually make the situation worse. You've got to try and stay as calm as possible. You have to try and listen very carefully. The whole idea is to try to calm them down, but by patronising them or insulting them, that's not going to help the situation. So you've got to really listen to their point of view and understand why they are feeling the way that they do. You've got to try and see both sides of the arguments, and you've got to politely, after you've listened to their point of view, to try to express your point of view without aggravating them further. However hard we try, sometimes people will not calm down. They will still be upset or aggressive, and actually sometimes it can lead to violence. People can get to be more physically aggressive, start coming up close to you in your face. They might be shouting at you. So you really need to think about where the door is when you are chatting to that person. So hopefully before you might have taken them away to a quiet area to talk to them about their problems or issues. If you've taken them into a room, you need to make sure that you know where that door is or other exit points, and you need to place yourself between the door and them. You need to remove anything that could be seen as a weapon. So anything you think they could pick up and hurt you with needs to be removed. You need to allow the aggressor personal space. Do not get close to them, do not get into their face, make sure you are step back. And you need to summon help as soon as possible by using a panic alarm, telephone, shouting for help, like I say, phoning for security.